Ladies and gentlemen, thank you for standing by and welcome to Webinar Wednesday using KentuckyHealthFacts.org History and Tour. During the presentation, all participants will be in a listen-only mode. If you would like to ask a question during the presentation, please use the chat feature located in the lower left corner of your screen. If you need to reach an operator at any time, please press *0. As a reminder, this webinar is being recorded Wednesday, November 20th, 2013. I would now like to turn the webinar over to Ms. Rochelle Seeger, Community Health Research Officer, Foundation for a Healthy Kentucky. Please go ahead.
Thank you so much, and thanks you all for joining us today on this conference call. Again, my name is Rochelle Seeger. I'm with the Community Health Foundation for a Healthy Kentucky. And this webinar today is part of our Foundation's Health for a Change training series. This is a free series, and it's comprised of webinars and in-person workshops designed to support the efforts of Kentucky's community health coalitions, agencies, health advocates, and interested community members. So I'm so thankful that you joined us today, interested in KentuckyHealthFacts.org. First, I want to begin with a brief introduction about the Foundation. The Foundation for a Healthy Kentucky was founded in 2001 with a mission to address the unmet health care needs of Kentuckians. Currently, the Foundation is working on three main focus areas. Promoting responsive health policy aims to make public policy more responsive to the health and health care needs of the people of Kentucky. Investing in Kentucky's future aims to improve the health of Kentucky's children by engaging in communities and tested innovative strategies. Finally, supporting community aims to support implementation or expansion of innovative strategies to improve the health of Kentucky's lower income communities. The Foundation does this by grant making, supporting targeted health and health care related research, providing policymakers with the resources and information needed to make decisions which impact the health of all Kentuckians, and by offering training and technical assistance through events just like this one. There you'll see the picture on the bottom of the slide, and that was our October Health for a Change training series. It was an evaluation workshop. At that workshop, we had experts on evaluation who guided us through the basics of building a sound logic model and evaluation planning and community health projects. It was a really exciting event. We had time at that event to do some planning, looking at logic models and how that works in our community. So this is the next series. We're talking today about KentuckyHealthFacts.org. Next, I'd like to direct you to the Foundation's website, healthyky-ky.org. There you'll find the archives of all the past Health for Training webinars, Foundation reports, issue briefs, and upcoming event schedules. For those of you on the call, I know you're passionate about data, so I want to highlight this training series that happened earlier this year in 2013 titled Go to the Source. This data series focused on all of the experts in Kentucky who access our data. For example, we had Dr. Sarah Jeannie Kanotra. She's with the Kentucky Behavioral Risk Factor Surveillance System, and she spoke about how that's happening in our state. Next, we had state demographer Michael Price, and he talked about the Kentucky State Data Center, another great resource for us data lovers to review the work around Kentucky demographic and economic data. There are many other pieces of this Go to the Source Health series, and I want to remind you that those are all archived on our website, KentuckyHealthFacts.org. The next slide, I want to remind you about our next upcoming series, another webinar scheduled for December 4th. On that webinar, we'll have an expert from Alliance for Justice, a lawyer there who will be detailing the federal requirements around 501c3. All of those details she'll get into, advocacy versus lobbying and what those federal regulations are around those issues. So please sign up for that. Again, another Health for a Change training series. Finally, in this opening segment, I want to let you know that we are open to your suggestions. You're out in the community doing fantastic work, so we are open to your ideas about trainings you may need, data that you're interested in looking at, and we want to be responsive to those needs. So please feel free to call on us for future trainings. Again, my name is Rochelle Seeger. I'm so honored to be here with the Foundation. I joined the Foundation for a Healthy Kentucky in September of this year. Part of the Foundation's mission is what I have at heart, so data and helping the health of Kentuckians move forward. So I'm so excited to be working here. Part of my work around the data efforts of the Foundation for a Healthy Kentucky include the annual statewide Kentucky Health Issues Poll. 2015, so down the road a ways, Kentucky Parent Survey will happen, and those are statewide surveys of Kentucky residents finding out about what they're interested in, what their thoughts are on different health topics, their health status, a lot of different issues going on with those surveys, so we're excited to launch those. Today's webinar, KentuckyHealthFacts.org, our data portal, will happen in 3 parts. First, we'll learn about the history and background of the website, KentuckyHealthFacts.org. Next, I will take us on a short drive through the website, pointing out some of the key features. And finally, Dr. Jay Christian, epidemiologist with the University of Kentucky College of Public Health, will review some of the key elements on the website. We'll also have time for questions and answers, so please use your chat box located in the lower left-hand corner of your screen to send us questions. Now, I'm so honored to introduce the Foundation for a Healthy Kentucky's President and CEO, Dr. Susan Zepeda. She will talk about the history and background of KentuckyHealthFacts.org. Thank you so much, Dr. Zepeda, and welcome.
Thanks so much, Rochelle, and thank you all for being on the call today. The origins of KentuckyHealthFacts.org were not in a galaxy far, far away because we haven't been around that long. But one of the very first grants that we did make was to Dr. Mike Samuels and the Kentucky Institute of Medicine, because we felt very strongly that if a problem is in the community, chances are the solution is in the community. And so often people working in Kentucky communities were having to deal with statewide data and infer from that data what their issue might be in their particular county, Perry County, McCracken County. And we wanted to be sure that they had the tools to address local problems and forge local solutions. And so what we did in contracting with the Kentucky Institute of Medicine was get them to take the Behavioral Risk Factor Surveillance System data, lovingly known as BRFSS. That's a Centers for Disease Control and Prevention, or CDC, sponsored survey that's conducted right here in Kentucky and in every state in the nation every year, asking Kentuckians about 20 to 25 minutes worth of questions on their own health behaviors. What the Kentucky Institute of Medicine did, Mike Samuels did, was analyze that data down to the county level and then create a book, because we weren't in the website business yet then, a book that provided not only each county's data but assigned each county a ranking in terms of how healthy they were compared to the other counties in the state. And we were stunned at the traction that this report got. Reporters all over the state were comparing, even the county that ranked number 2, it was a story. They wanted to know how to become county number 1. And you can imagine the impact in counties number 118, 119, 120 as a wake-up call of what they could do in their community. At the back of this book, there were some suggestions, solutions, possible strategies to engage in. Not very long after that, probably a year or 2 later, the Robert Wood Johnson Foundation contracted with the University of Wisconsin at Madison to engage in a similar ranking process for counties within every state in the nation. And at that time, Dr. Bill Hacker was the Commissioner for Public Health, and he and I sent a joint letter to every county in the state explaining to them why the rankings produced by the Wisconsin folks were slightly different from the rankings produced by the KIOM study. It became very clear to us that it was confusing to have 2 different sets of rankings. And so we discontinued the process of ranking, but we remained committed to having that local data available. One of the things that was very important to us when we started this work was to be sure that it was transparent to the people using the data how we arrived at those local county numbers. And originally, for whatever reason, the KIOM group felt that that was proprietary information and they didn't want to share their methodology. As a result of that, we began meeting with the Commissioner for Public Health and his epidemiology staff, as well as epidemiologists at the University of Kentucky. And our pact with them was if they could agree on a methodology, a statistically valid methodology to get data down at the county level, and to be transparent about how they got that data, then we would create a website and post that data every year for local practitioners, local policy makers, and local community health activists to draw from the same sheet of music, if you will, about what the data was in their community. Now, we knew health needs were only part of the story, and so early on we also began contracting every 3 years for a Kentucky Health Market Report. Our thinking is that the BRFSS data tell us the needs. They tell us how sick people are, how much difficulty they have accessing services. And the Kentucky Health Market Report would map out for people what the health resources in their communities were, so local planners could have an even-handed and balanced approach. And the reason we picked 3-year intervals for that is we'd been told by people like yourselves, who are often writing grants for funding, that data that are more than 3 years old are not considered particularly timely or relevant. So annual data on KentuckyHealthFacts.org from the Behavioral Risk Factors Surveillance System Survey, and every 3 years data from the Kentucky Health Market Report. Just to go back over again, this is a partnership, an ongoing partnership among the Cabinet, particularly the epidemiologists in public health, the Foundation for a Healthy Kentucky providing the website platform, and the University of Kentucky epidemiologists crunching the numbers from the BRFSS data of each year to get data down at the county level. And again, we're so committed to transparency. Part of this website today is going to be Jay talking about the methodology that's used. So you'll know where these numbers come from and what their limitations are. Looking ahead to where Kentucky is going in the future, Rochelle actually mentioned some of the important things. We will be redoing the Kentucky Health Market Report. In addition to these data about each county, we also provide you with data through the annual Kentucky Health Issues Poll, which is a survey of opinions on health policies from 5 different regions of the state. So you can look at the region closest to your home and see what your constituents are feeling about a certain issue, what struggles they may be having accessing health care, or whether they've had experience and have viewpoints on things like smoke-free ordinances or proper approaches to childhood obesity. We also, every 3 years, conduct the Kentucky Parent Survey. We do a lot of work in the area of children's health, and who better to ask about children's health than parents? And so we do those telephone surveys every 3 years to get a window on parents' views about what's needed in Kentucky to help our children grow up healthy. So we have 2 different websites. Healthy-ky.org is where all our past webinars and all our issue briefs and reports are available to you. KentuckyHealthFacts.org is the place to go for Kentucky health data. And now I'll turn it back over to Rochelle to help you walk through that data site with us.
Thanks so much, Dr. Zepeda. That was fantastic to learn the background of what things are happening here and what we can look at the data. Now I'm going to drive us over to our website here and take a look at what we can see on KentuckyHealthFacts.org. And it's so exciting because you can access this data a lot of different ways. So many people I talk with in the community say, where do I start? And I love to start with KentuckyHealthFacts.org. So let's click on the home page here. And this is, you can see where it comes up. So as I mentioned, we can enter via county or by a topic. So you can kind of see how we want to enter those beginning stages of looking at the data. Under our About Us tab, you'll see some of the history that Dr. Zepeda just mentioned. and a little bit about the data in the middle, considering those trends. Down at the bottom of the page is what I love to find on websites when I go looking, is this citation information. So if you're pulling data from KentuckyHealthFacts.org to put in a grant application, a research paper, or something else that you're using, you'll definitely want to make that citation. I, as a data person, also know when I read reports in the community or see reports in the newspaper, that's my first question. Where did they get this data from? Is it a reliable source of data? And that's something that here at the Foundation we pride ourselves in. So here at the bottom of the page, under citation information, you can get that format information. Where it says data source, that is what we'll pull from the data charts that we'll look at. And I'll give you that information, and you can see the example below. Next, we can click on data by location. So let's say I live in Barron County, and we have some communities, people, church members mobilized who want to do something about the health in Barron County. Anyone on the call from Barron County? This is just the county that I picked, so you can email me afterwards and tell me what the real picture is, if that matches up with the data we're going to look at today. So you can see if I hover over the county here, it shows me Barron County, or I can select Barron County here from this drop-down menu. So let's do this cool way where it hovers over and click on Barron County. So here's the starting place. Our topic groups are categorized. Here in this drop-down menu, we can compare our data on Barron County to Kentucky or the U.S., or we can compare it to other counties that we may be interested in looking at that comparison. You can also see here Barron Ad District is listed as Barron River. The hospital located in Barron County is T.J. Sampson Community Hospital located in Glasgow. So I'm going to go ahead and click all these buttons to see what kind of data we're going to pull up here. All right, you can see the page is reloaded. We have some basic demographic information at the top of the page, total population of Barron, high school graduation rates, per capita personal income. I'll scroll down a little bit here so we can check out some more things. Smoking, percentage of adults in the middle, tooth loss, limited activities in the previous month, binge drinking. Let's look at this one in the middle of the page, limited activities in previous month. You can see down here where it says data source, it says BRFSS. So that's that survey that we were talking about earlier in the call. If I click on that, it's going to jump to the bottom of the page. And here we can see BRFSS and a description of the data source. It's from the Centers for Disease Control and Prevention and the Kentucky Department for Public Health, Behavioral Risk Factor Survey, and some other details about that indicator. So if you think back to that first page where we looked at the citations, this is the information under description through College of Public Health that we would want to insert in our citation. Back up to our data. Also, if you look at limited activities in previous months, you can see about the indicator. This is great because it tells us what the question was asked in the original BRFSS. So this is the numbers representing the percent of adults who could not perform work or household tasks due to physical, mental, or emotional problems. I love the screen because it gives us a snapshot of the community, but it doesn't give us 258 different data elements, right? This is a manageable piece of how we can describe what would be happening in Barron County from some sound data elements. So let's look at some of these data indicators. So I want to look at the personal per capita income in Barron County. So here this screen compares it to Kentucky and the U.S. We can see about the indicator that it's the mean income for every man, woman, and child in a particular group, and the data source is the American Community Survey, U.S. Census Bureau. So I'm going to click through here. All right, so in this next screen we have our county and state, and that's really great, but remember I was talking about in Barron County we had a group of interested members in our community who wanted to advance some health issues. So let's start by looking at some of the other counties that are in our area. So, what I did, let's look at a bar graph. This next one, we want to look at Barron County and all of its neighboring counties. So I imagine this coalition of people getting together and saying, what's going on in our community? So they've mobilized together. If I wanted to look at our incomes in our area, we could click on this screen under Geographic Area, and we select the counties. So Barron is our main county. We have Hart is a neighboring county. Metcalf, Monroe, Metcalf, Monroe, Allen, Warren, and Edmonton. Edmonton right here. And now I go back and click on Submit. All right, so we have all of our counties listed here. Great. So maybe if I was making a presentation on our next strategy meeting for our organization, we could kind of see what the incomes in our areas look like with respect to per capita income. If I wanted to sort that, I could sort that by high to low. Again, a nice piece that I could use a citation here, insert it into a PowerPoint slide, email it to myself, print it. I can also download all that data that's behind this this bar graph right here. Again, you can see the years on the top of representing those personal income data. Next, we want to look at this data by topic. So here are all of our categories that we saw on the first screen. Let me just expand all of these sections and see what we have here. Here's a good start. So see under demographics, this is exactly the category we were looking at before. Under social and behavioral health, we can look at all of these, many of them originating from BRFSS data, some health outcomes data, and access to care data, maternal and child health data, senior health data. And you can see how you could really guide the discussion in your group that's mobilized. So we were brainstorming ideas on what we wanted to work on. We could come back to KentuckyHealthFacts.org to see what some of our problems in our community or where our resources were. So let's look at the recommended fruits and vegetables. I love that one. Okay, so are people eating somewhat healthy? All right, again, so here we have our recommended intake of fruits and vegetables, and all of our counties are listed. So here we see county, group, and county. This is a part of the BRFSS analysis that Dr. Christensen from University of Kentucky has worked on. He's going to discuss some of that later in our call. Again, you can download the data file, print. We want to always check our resources and know our citations. So we see here at the bottom, Centers for Disease Control and Prevention. It's a BRFSS, Behavioral Risk Factor Surveillance Survey question. And again, we know that it's the percentage of adults who consume 5 or more servings of fruits and vegetables per day. Again, thinking about our coalition that hopefully we formed in Barron County, we can click on the map and see what our area looks like in respect to the whole state of Kentucky. I love this map because I can hover over Barron County and it shows the numbers there. Warren County, you can see to the left, it also had a higher income, and they're reporting higher levels of fruits and vegetable consumption. You can see here on the left-hand side of your screen is the key so that we know what those colors are indicated on our map. All right, ready for the next step? Another one that I love. Let's go back and look at, again, social and behavioral indicators. And let's look at lack of physical activity. Similar to fruits and vegetables, this is an area where many communities are putting their resources and putting their heads together to see how they can make change. So a couple things to note on this slide. Again, we have all of our counties. We have the different time frames available. We can do what we did at the last time if we want to just compare Barron County to its neighboring counties. But here I want to scroll down and point out Bourbon County. That's not in one of our groups right now, but what happened with Bourbon County? Why is it 0? Jay's going to talk a little bit more about that, about why we use these county groups and not just the county level data. So stay tuned. All right. So, Behavioral Risk Factor Surveillance Survey, it's going to celebrate its 30th year, and there's a lot of questions that we are relying on to populate this data. As Dr. Zepeda mentioned, we also rely on indicators from, for example, let's look at health outcomes. So health outcomes, we rely on things like cancer deaths. When we look at cancer deaths, we can see all the way, scroll down to the bottom, hang on everyone. We can see that Kentucky Cancer Registry has provided that data for us. We can see some notes on the indicators here around breast cancer and how those are calculated. In data for counties fewer than 15 is unstable, so they have suppressed that data. And again, that description is for you for the citation of the data if you are interested in cancer data. Let's go back up to take a look at some other health outcomes data. Health outcomes. Infectious disease, same thing. We can see that that's per 100,000 population. We have our USA rate, Kentucky rate, and then our county rates. So this indicator under tracking health values is an indicator that was developed in 2009, and we're currently working on rejuvenating that indicator. And it really was the philosophy that Dr. Zepeda mentioned, where we are looking to move forward some indicators and track how we can move the needle and score that. Are we making change? Are things improving in our communities? Or where can we put resources, time, efforts, and passions to make change in our community? So those are some of the indicators. But what mainly I want to point out is that all of these tabs, data by location, data by topic, tracking health values, are linked. So as you saw in data by location, we can go back and it's going to link to the data by topic. So you don't have to think that you need to check all those 3 tabs for data. That's the same core of data that's going to be presented in different ways depending on what your coalition or what your interest is. Finally, I wanted to show you this great resource page. So if you have a good picture of your community, you have things that you're interested in like income, healthy eating, how many fruits and vegetables people are consuming, activity levels, and maybe we want to think of a strategy. So say our coalition looked at those items and we're really mobilizing around increasing people's fruits and vegetable consumption in our community. So 1, we have a coalition of counties that are together around this, and we've looked up some beginning health data, and we're really ready to drive forward. This is a great page that has been put together by the foundation that lists a lot of great sound resources in our community. For example, Kentucky State Data Center, I mentioned that at the top of the hour. The folks there put together excellent economic census data for Kentucky. So that click-through will go to their website. State demographer Michael Price works there, and lots of great people putting together really manageable pieces of all of the state economic data and census data that's available. Again, U.S. Census Bureau. Here's to the CDC in the middle of the page, Risk Factor Behavior Survey. Kentucky's link to that BRFSS survey. Let's see some other good ones. All right, let's say your community, as I mentioned, is really interested in doing this food issue, food access. We want to move forward on that item. We looked at the data, and that's where we have our passion. So this is a great one, Your Food Environment Atlas. I'm going to click through to that. All right, so here we are at a different website, not Kentucky Health Facts, but I want to show you how Kentucky Health Facts can guide you to other great community resources. Here we are. Let's see what Kentucky looks like. All right, we'll zoom in, and we're going to find Barron County. Click on that. So here we are again, different website, USDA. We've clicked through from Kentucky Health Facts. We're on a different website. And this website has tons of information about food, access to food, population to store ratio, seniors access to stores, let's see, even more. Store availability, restaurant availability, food assistance, food insecurity. Whoa, loads of data around food. So this is going to be a fantastic expansion of our idea that we want to move forward in our community around access to food. All right, let's head back to KentuckyHealthFacts.org. Under Access to Care, you see some of our colleagues at University of Kentucky with different county health profiles here, a lot of health data, the HRSA shortage area, Kentucky Office of Health Policy, lots of great resources. So this is what I love about KentuckyHealthFacts.org. It's a perfect starting place to get a snapshot of what's going on in the community. It's not a website with 350,000 data elements that we have to sort through and figure out. It really is, as Dr. Cepeda mentioned, a function of how our counties are working and what Kentucky looks like, so we can drill down and bring that data back to our community meetings. So clicking us back to that citation information, you can see at the bottom of those pages we looked at in those data charts, this is where we would plug in our information here into our data source. So if this was from the Kentucky Cancer Registry, we'd plug that in, and we'd have our citation all ready to go for our report or our grant. Very important piece of information. KentuckyHealthFacts.org, data by topic. Again, maybe it's a different avenue you want to take. You could investigate through youth. We want to look at children and youth. Immunization we have here, K-CHIP enrollment, uninsured children population. So again, what your community is mobilizing around or have passions around, you can find health data to support some of those initiatives. All right, KentuckyHealthFacts.org. Don't forget to check it out. Now I'm thrilled to turn over the presentation to Dr. Jay Christensen. He's with the University of Kentucky College for Public Health. Again, he's done a lot of work around providing data for our KentuckyHealthFacts.org website. Now, Dr. Christensen, welcome to the call.
Thanks, Rochelle. So I'd like to start out today talking a little bit more about the behavioral risk factor surveillance system data and how we have used it to track the health of Kentuckians. The first thing to realize about the BRFSS is that it was designed to produce statewide prevalence estimates of health behaviors and health outcomes. And to do this, they use a very complex sampling design and survey techniques that allow us to get population-based estimates for each state. So here on this slide you will see a snippet from the CDC's BRFSS website showing the prevalence of diabetes in several states and nationwide in 2009. Now, something we can do to improve the precision of our estimates is to combine a few years. So you see at the bottom here, I've got the diabetes prevalence for Kentucky from 2008 to 2010, which is about 10.5%. Now, next to this, you'll see a 95% confidence interval. And for those of you who aren't so familiar with these or statistics, this is basically a measure of the precision of our estimates. So since our confidence interval here is 10% to 11%, we know we have a pretty good idea of what the diabetes prevalence was in Kentucky during these years. However, because we are interested in helping local communities use the BRFSS to understand trends in health within their communities, we want to look at smaller areas, rates of certain health behaviors and conditions. So as it is now, the state BRFSS office does provide reasonably precise estimates for a variety of conditions and behaviors at the area development district level. Now, I assume most of you are familiar with these area development districts, but if not, they are collections of counties in several regions across the state, and there's about 15 of them, and they contain anywhere from about 6 to more than a dozen counties apiece. And while these do provide reasonably precise estimates, these are fairly large regions, so they don't give local communities a very good indication of what conditions are in their county. For this reason, we developed a new regionalization algorithm to create smaller groups of counties that have similar demographic and socioeconomic profiles. In other words, we grouped counties together based on the age structure in the population, the educational attainment within the population, and so forth. So then we can then get estimates for those county groups to represent the prevalence of whatever condition we're interested in that county based on similar counties in its region of the state. So I have here an example in the table below. And in the blue you'll see County A and County B. And you'll see over the years 2008 through 2010, County A only had 64 respondents to the BRFSS, which is not a whole lot. And you'll see that our prevalence estimate for diabetes in this county for those years is 11.5%. Now if you'll look next to that, there is the 95% confidence interval showing that we actually have very low precision due to this small number of respondents in County A. 4.8% to 24.9%. Now this is a rather large confidence interval, so the estimate then becomes, well, not very useful if we can't say with any more precision what the diabetes prevalence is in this county. In County B, however, you'll notice that over these 3 years we have 690 respondents, yielding a diabetes prevalence estimate of 8.6%, with a 95% confidence interval of 6.5 to 11.2%. Now this is a much smaller confidence interval indicating that we have much better precision with our estimate here. So in the green boxes next to this, you'll see our County A estimate, which is actually the estimate for a group of counties that County A belongs to. There are about 5 other counties in this group with County A, and you'll see that over the 3 years, 2008 through 2010, they had 533 respondents and yielded an estimate of diabetes prevalence of 7.6%. And you'll notice that the 95% confidence interval has shrunk considerably and is now much more precise. Now you'll notice that just under County A we have the same numbers for County B, and that's because in our regionalization algorithm we let single counties that had sufficient numbers of respondents for stable estimates to stand alone. There's no reason to combine them with other counties when they have sufficient respondents for precise estimates. So that's sort of what's going on behind the scenes. And on this next slide we'll see how this information is displayed on KentuckyHealthFacts.org. You've already seen some of these screens here. On the left we have the tabular view that shows both the county estimate and the county group estimate for each county from 2008 through 2010 for diabetes. Now, of course, next to the estimate you will find the 95% confidence intervals for both the county and the county group. So you can see how the prevalence estimate itself changes, as well as the precision of that estimate between the counties and county groups. And of course on the right side we have the map that shows the county group estimates at the county level, and we see we have a pretty nice map here showing clear regional trends in the prevalence of diabetes across the state. Now as Rochelle mentioned, there will be some blanks in this percent column for individual counties, and that's because for some counties we have so few respondents that we don't even feel comfortable revealing or producing an estimate. It might be if you have few enough folks from a single county who responded to the survey over these 3 years, you might have an estimate that is just absolutely unreasonable, up in the 20–30% maybe. So we mask those percentages for that reason. Well, that about wraps up my brief description here of how we have used the BRFSS data to present more local estimates of prevalence of certain health behaviors and conditions. And I'm happy to answer any questions anybody out there listening might have.
Great. Let's see some of the chat questions that are coming in. Anyone else have questions? Go ahead and log them into the chat box. Let's see. Here's one around those BRFSS county groups. Let's see. Dr. Christian, why are the rates from the BRFSS presented for 3 years combined?
Right. Now, as I mentioned, combining counties into county groups gives us units of analysis that have a larger sample size. And the more respondents we have, the more precise our estimates get. By combining years, we can also increase our sample size for each county group, therefore further shrinking the confidence intervals to give us a better, more stable estimate. And by stable, I mean that we're not going to see the rate jump around so much from year to year. By combining 3 years at a time, we're doing sort of a rolling 3-year estimate, and this sort of helps to smooth out those wild fluctuations we might see based on in counties with small sample sizes.
Excellent. Excellent. This is a question that we get frequently, and we could both answer it, so we can both weigh in on this one. This one is about the data. So I look at one site for health data, and I get some statistics, and I go to another site, and it creates a different picture. Who is right and who's wrong? How do I proceed? Do you want to start, or should I give it a shot?
Well, I'll start by just saying it is tricky sometimes to know exactly which numbers to use. And it's not always clear that there is a right number or a wrong number. I think the most important thing is to use the number that based on your experience in general seems more appropriate. Would you have anything else to add?
Definitely. I already mentioned it. The first question I always ask is, where's the data coming from? So here at Kentucky Health Facts, we have linking back to federal data, Kentucky data from the healthcare side of things, from our Kentucky Office of Health Policy. So I can make a clear trail if I pull information from Kentucky Health Facts on where that data is originating. For example, the BRFSS data from the CDC, a very sound data source. So that, I think, is the most important, knowing where those came from. And yes, we have millions of data elements out there, and putting them all together might create a slightly different picture than looking at some individually. But the thing is, we can't be paralyzed by the data, right? We can't look at 500 data elements and try and make a sound decision in our community. That's a research study for 10 years, right? And I know for myself and for other community members I talk with, we're ready. We're ready to look at our data and make a program and move forward with making change in the lives of our kids and neighbors, friends and family members and seniors in our community. So it's a balance, but I would recommend looking for, one, what is the data source? Where did they get this piece of data that we're looking at? That's my main thing. Whenever I'm reading a report in the newspaper, where's the data from?
I think that's an excellent point, and I really do think that we've done a good job on KentuckyHealthFacts.org making it very clear on every page where the data are coming from.
All right, let's see another question. This is a great website. Is it okay if I direct my students to Kentucky Health Facts?
Absolutely. Yes, I think this website is great for students. It presents the information fairly simply, and a lot of the number crunching has already been done for them.
Yeah, and what I would add is I get so excited when students are excited about data, because I feel like understanding that and having a handle on that can really shape policy in our community, shape programs of where they want to go, be they nursing students, public health students. So one of my first days on the job, I got a call from a nursing student who was writing a paper about diabetes. So she had some questions about the data and how she should present that in her paper. So I was thrilled to engage with her on one of my first days on the job here at the Health Foundation for a Healthy Kentucky. So that was really exciting for me. All right, let's see, Jay. Here's one more question. It looks like this one's going to be for you too. Let's see. Which demographic and socioeconomic variables were used to create the county groups?
Yes, that's a good question. When creating the county groups, like I said, we compared counties and grouped them based on similar socioeconomic and demographic characteristics. Now, all the data for those comparisons, of course, came from the 2000 census or several years' worth of data from the American Community Survey that the census administers. And those variables were things like educational attainment, the percent of the population in that county with a high school diploma, for example. The percent living below the poverty line was another important indicator. The percent of the population that's 65 and over. Obviously advanced age can change one's health behaviors and health in general. And we also looked at the percent of county residents who were African American. Obviously there are some disparities in health behaviors and outcomes between white Kentuckians and black Kentuckians. And we also looked at the urban or rural nature of the counties as a sort of general proxy for the accessibility of healthcare services.
Great, thanks. We have a few more questions coming in before we wrap up things for the afternoon. Let's see, this is a good one. Oh, this is a question for me. Let's see. I'm on your site right now and I'm having problems with my county's data. What's wrong? Depends on what kind of problems you're having. But this is always something that's challenging with running a website. It's a live thing. It's living. So if there are any questions, comments about the data, things aren't working, please feel free to just send me an email through KentuckyHealthFacts.org. There's a comment section, or you can get my email at the end of this. I'm open to your eyes and ears on seeing what's wrong, what may not be working correctly, and I want to get that fixed up. So it is a living, breathing thing. I already have a list since I've joined here of things I want to fix on the website, so I'm excited to get that started. But it's people just like you who are out there using the website that can see things that I may not understand. Oh, this is not labeled clearly, or this is not working properly. Feel free for that feedback. So let me know what's working and what's not working. I'm happy to look into it and find out what's happening with that. All right, Jay, it looks like here's one more for you. How many years of data are available for looking at trends in rates?
Oh yes, on the KentuckyHealthFacts.org website, you can look at trends over time. And like I said, there are the estimates from the BRFSS are sort of 3-year rolling estimates. And I think these go back through 2003. So the first year you can look at in the trend analysis would be data representing years 2003 through 2005. And then the next set of data would be 2004 through 2006, and so on up till 2010 now. So I think that works out to 5 or 6 time periods that you can look at temporal trends.
Right, to see how things are changing in my community.
Mm-hmm.
Awesome. All right, let's see. If you have a burning question, send it on over in our chat box. Let's see. We have a question. Is there data on Hispanics and Latinos in Kentucky? Ooh, very good question. I'm happy to go for it. Or Jay, you want to start us off?
Well, that is a good question. I know that there has been talk in the BRFSS office of well, not just talk, but some work in the BRFSS office trying to extend the BRFSS survey to cover more Hispanic residents of Kentucky. I don't think at this time that there are sufficient number of Hispanic respondents to the telephone survey to have separate estimates, at least in most years. So that is difficult. Statewide, there might be enough Hispanic respondents that we can do statewide estimates of health behaviors and conditions among Hispanic residents. But at the county or county group level that's not quite possible yet.
Right, exactly, and it just goes back to your point about the county groups and why that's important, because if we looked at Hispanics by county, we would have so few numbers that we'd have those really big confidence intervals that you showed us, so we wouldn't have a really good representation to make decisions on because of the small numbers.
That's right.
So I'm happy to do some more investigating. There's not on KentuckyHealthFacts.org specific data around Hispanic and Latinos, but I'm happy to do some investigating. And so feel free to email me and we can take a look to see who has some good, reliable data around Hispanics and Latinos in Kentucky. BRFSS is starting that, yes, so that's exciting to do some oversampling and specific surveys to try and get Hispanic Latinos' opinions around those behavioral risk factors that the BRFSS collects. All right, wrapping up time. So chat your questions if you have any. I want to thank all of you for being on the phone call today. Kentucky Health Facts is something that I'm so excited to get into. I love data in my heart, and it always reminds me of this one professor I had at statistics, and he made this comparison. He said, it's just like in the summer, right? In the summer we can see that there are a lot more drowning deaths due to ice cream. I know you all are going, what? What in the world did she just say? But this is the essence of statistics and data. We can have numbers because we can look at the number of drownings and the amount of ice cream that's eaten and see that there's a great correspondence between increased ice cream eating and increased drowning deaths, right? We can see that. It's very clear. As people eat more ice cream, there's more drowning deaths. When we dig into the data a little bit more, we can see that there's different things going on. And maybe if we dig in even further, we can see that, in fact, there are many more people who are swimming in the summer, and that's why there's more drowning deaths, even though that correlation between ice cream and drowning looks very significant. So I always bring up that example because it's powerful. These numbers we have are powerful and hopefully can drive us to make accurate and good decisions for our communities and areas where we're doing community work. So I love data. Feel free to call on me with your questions. Finally, my contact information and our Twitter handle, KentuckyHealthFacts.org. If you're already following us on Twitter, you'll know that KentuckyHealthFacts.org Twitter was blowing up yesterday because we had a great event up in Erlanger, Kentucky called the Data Forum, where we had a bunch of data people getting together looking at what's happening in Kentucky and Ohio around data issues. Check it out on KentuckyHealthFacts.org, and our website will have those presentations up there. A reminder that all of those past Health for a Change are archived on our website, the Foundation's website, healthyky.org. Just go under Data and Reports and then under Videos. And finally, I want to thank all of our presenters today. Special thanks to Foundation for a Healthy Kentucky President and CEO, Dr. Susan Zepeda, and of course you, Dr. Christian, from joining us from University of Kentucky College of Public Health. I thank them for their time and their expertise, and also you, to the participants for Health for a Change. I'm so happy you've joined us today to learn a little bit more about the basics, how to identify those county groups and look at those confidence intervals, and finally able to correctly cite the Kentucky Health Facts website so we can have good, reliable reports for our community members and to drive what we're doing in our communities. So thank you again. I appreciate your time. I look forward to communicating with you on KentuckyHealthFacts.org. Thanks for your time.
Ladies and gentlemen, that does conclude the webinar for today. Have a great day, everyone.